Welcome to Indian Anatomist. Individuals who want to pursue a career in medicine are welcome to check out the YouTube channel Indian Anatomist. To all the students, in this discussion, we will explore the concept of scapular anastomosis, a region primarily located in the upper limb, specifically surrounding the shoulder joint. What is anastomosis? Anastomosis typically refers to the establishment of a link between tubular anatomical structures, such as blood vessels, or segments of the intestine. In surgery, an anastomosis is a way to join two parts together. For example, during intestinal anastomosis, that is, ileocolic, or ileocolonic anastomosis, or colectomy, the two ends of an intestine are stitched, or stapled together, after a piece of it is physically removed. In human body, there are different types of anastomosis are present. They includes 1. Vascular anastomosis, 2. Bowel or intestinal anastomosis, and number 3 is genitourinary tract anastomosis. Here, the pictures showing the either bowel or urinary tract anastomosis. Vascular anastomosis happens naturally when veins and arteries unite to move blood. It provides blood flow back up in the vascular system if a vessel is blocked. Through damage, inflammation, or disease, blood vessels form aberrant anastomosis, called vascular fistulae. Now coming to types of vascular anastomosis. Number 1 is arterioarterial anastomosis, which connects two arteries. Number 2 is veno-venous anastomosis, which connects two veins. And finally, number 3 is arteriovenous anastomosis, also called as shunt. It connects an artery to a vein. This procedure can create durable dialysis access for people with kidney failure. Anastomosis can exhibit either normal or abnormal characteristics. Anastomosis can be either acquired or natural. Anastomosis establishes collateral circulation. Fistulas are frequently referred to as abnormal anastomosis, which can be either congenital or acquired in nature. Now, what is collateral circulation? Collateral circulation is an alternate blood flow around a blocked artery or vein. It is caused by vascular multiplicity or new blood vessel branches, produces a specialized endogenous bypass blood channels. How come the collateral circulation is useful to our body? The collateral circulation is crucial in ischemic stroke, coronary atherosclerosis, peripheral artery disease, and other illnesses, thus it protects the tissues against ischemia. Dear students, with this quick overview of the vascular anastomosis, I'd like to begin our discussion of the scapular anastomosis. Anastomoses are most abundant in joints and intestines, where blood flow can be disrupted or obstructed. Upper limb arterial anastomotic networks are the topic of this study. The upper extremities receive most blood from the subclavian artery. Subclavian arteries supply the head, neck, and thorax portions. It is formed between the arterial branches of first part of subclavian artery and third part of axillary artery, in relation to posterior or dorsal surface of the scapula. The primary purpose of this physiological mechanism is to facilitate the circulation of blood within the scapula and shoulder joint. Additionally, it serves to establish collateral circulation in the event of injury or obstruction. The branches that contribute include transverse cervical artery, branch of thyrocervical trunk of first part of subclavian artery, suprascapular artery, also a branch from thyrocervical trunk of first part, or direct branch from third part of subclavian artery, subscapular and circumflex scapular arteries from third part of axillary artery. In addition to scapular anastomosis, these branches also establishes the collateral circulation over the acromion process of the scapula, called acromyal anastomosis. It is formed by the acromyal branches of the suprascapular artery from subclavian artery, thoracoacromial end, anastomotic branch from anterior and posterior circumflex humeral arteries. Dear students, finally, what is the clinical significance of collateral circulation via scapular anastomosis? In cases where there is occlusion of the subclavian and axillary arteries within the range that extends from the first part of the subclavian artery to the third part of the axillary artery, the scapular anastomosis serves as a viable route for collateral circulation. This anastomosis facilitates the flow of blood between the first part of the subclavian artery and the third part of the axillary artery, thereby ensuring sufficient circulation to the upper limb. Dear medicos, I trust that all individuals acquire an understanding of the scapular and acromial anastomosis. I trust this mini lecture was enjoyable for everyone. Please like, share, comment, and subscribe. Good day all.